Tonight, an alarming story. Suicide rates are on the rise on college campuses across America.
The American College Health Association says that suicide is the second leading cause of death among college-age students. Last year, more than 1,000 students committed suicide. Experts say the #1 cause of all suicides is untreated depression. And joining us now is psychotherapist Cindy Crane to talk more about this issue. Cindy, good to have you with us tonight.
Yeah, thank you for having me.
What do you make of this alarming rise in suicide among young people?
You know, I think there's a couple things that are going on, but the biggest one I think is untreated mental illness. We're not getting the diagnoses soon enough or the correct treatment.
So what can we do to help prevent this then?
Well, I think it's making sure kids are aware of access to the mental health services that are available, but really, even a precursor to that is helping our adolescents really learn how to manage transitions. It's really tough going to college and the pressure is huge, and I think we need to better help prepare our kids for the pressures, including resources if it becomes overwhelming.
Yes, I was going to ask, is there something particular about college life that perhaps triggers whatever issues that might lead to suicide?
Yeah, absolutely. I think there's both the transition of leaving home for the first time, academic pressures, social pressures, sexual pressures, pressures to drink, and I think it's overwhelming, and we need to help our adolescents and our young people learn how to better manage it and get help when they need it.
So what are the signs that someone we should be looking for that someone could be in trouble?
We are more concerned about kids who are more withdrawn, maybe not going to class, maybe change in their mood or their attitude. Even anger sometimes can be symptoms of depression.
Where can people then turn for help? You know, I know that there's so many resources on campus, but perhaps someone may not feel comfortable going there. But where can you turn for help?
It's really important to remember that your first resource on campus is the mental health services center there at the campus, but also asking for help among others. We need to make mental health be as easily accessible as physical health. Asking friends for help, parents for help, anybody.
And also destigmatize, any sort of mental illness, because I think that's also the barrier that a lot of people face.
Yeah, I think that the idea of mental illness is still one that is not exactly even with physical health, and we need to find more ways to talk about the parity between the both and treat mental illness just as seriously as we treat physical illness.
Psychotherapist Cindy Crane, as always, thank you for your insight.
Thank you so much.